It's 5:30 p.m. in Toowoomba, and a phone call from Evelyn, one of your patients, reveals that her husband Roy may have taken a bad fall and lost consciousness, and is perhaps dead, according to Evelyn. So what are some differential diagnoses? A few differentials for a collapsed patient that we discussed last week involved polypharmacy and pituitary apoplexy, where there is bleeding or impaired blood supply to the pituitary gland, which impedes adrenocorticotropic hormone release, leads to endocrine dysfunction and poor blood pressure maintenance, particularly hypotension upon standing. We also discussed Adams-Stokes syndrome, where an issue with your heart, such as bradycardia and atrioventricular conduction block, can lead to syncope without warning symptoms. Perhaps it could be a transient ischemic attack or a stroke. Roy is a retired Telstra maintenance officer, living off superannuation with his wife Evelyn, who has dementia. Roy has been cooking most of the meals and looking after the house and the garden, which has all been pretty tiring. He has smoked 20 cigarettes a day since his teens and has hypertension, is overweight, and has diabetes mellitus. Upon assessment, Roy was conscious, understood commands, and had no visual issues. He had a right-sided facial droop and slurred speech, had no muscle tone or deep tendon reflexes on his right side, and a positive Babinski reflex on his right foot, suggesting an upper motor neuron lesion. He also had high blood pressure and a slightly low pulse, suggesting increased intracranial pressure as per Monroe-Kelly doctrine. A CT revealed a hypodense lesion in the white matter of the left cerebral hemisphere, adjacent to the frontoparietal junction, and no signs of intracranial hemorrhage. This is consistent with an ischemic stroke of the left middle cerebral artery. Roy is started on antiplatelet therapy to prevent aggregation of platelets. Consultation with a speech pathologist reveals that Roy has expressive dysphagia and is at risk of aspiration, suggesting damage to Broca's area. He is given thickened fluids and a vitaminized diet and continues to work with a physiotherapist and a speech pathologist.
Created using Powtoon.